Well, I don't know about you, but if there's one cosmetic treatment I can't bear, it's an over-exaggerated pout. So today I'm here to interview the London lip queen, Dr. Rita Rakus, to find out whether it's possible to get a naturally looking enhanced pout. Rita, you're known as the London lip queen for a reason, so it seemed very fitting that we came to you for our lip treatment. Tell me, what are the main aging signs you see around the lips?
The main aging signs, you have one, loss of volume, especially the top lip. Then you do have the lipstick bleed lines, and then later on further lines. They're not necessarily related to smoking or sun damage. Some of them can just be genetic. I have patients come in and say, I don't smoke, I don't go in the sun, and I've still got these lines. So it is helpful if you do look after yourself as a preventive measure earlier on, and obviously don't smoke, be careful with the sun, and then have a good skincare regime. You also get a dropping of the corners of the mouth, the oral commissures. That again, you can help slightly. We're a great advocate of facial exercises, so if you do those from an early age and look after your skin, you can help what we call perioral aging. But luckily now with fillers, when it does finally set in, and it's better to have a treatment sooner rather than later, because especially once these lipstick bleed lines get quite deep, they can almost become like scars. It's very hard to lift them out, so it's better to come in and have a chat. And we pride ourselves on doing very subtle treatments, so no one really notices that you've had anything done to your lips. They just look fresher, or if you've got good lipstick on.
So I think that's everyone's biggest fear when it comes to lip fillers, isn't it? Because we see so many dreadful indications, or even I saw Sharon Osbourne recently, and you're just like, oh, what have you done to your lips? And it's just, you know, people are just terrified of having anything done to their lips. How do you get that natural look? It's obviously possible.
Yes, well, you have to be very subtle, have a good eye, and in fact we've had people over from Los Angeles to have their lips done because they don't want to have an artificial lip treatment. So one is to have a very subtle treatment. Two is to work with your patient, because you know they'll come in, sometimes patients will come in with photographs, but it's something that wouldn't suit them, or lips have a mind of their own, so it's very hard to really get them to do something that they don't want to do. So what we often do is stage the treatment in 2 or 3 parts, and we'll put a tiny bit in first time and have a look how the lip reacts. Then I also don't use local anaesthetic, because that can, you know, the old-fashioned dental block, because that can swell your lip up quite a bit, and then you really don't know what you're doing once the lip's swollen. So one, we use small amounts. I work together, I sit the patient up, because once the patient's lying back, your mouth shape changes. Put small amounts in and work with the patient, and do it very, very gradually, and then say no when you get to a point where you know you just shouldn't have any more.
So are you very much in control of the shape of the lip? It's not that you can give someone fillers and then the lip responds in a way you weren't expecting.
Well, from experience, as I've done about 40,000 treatments, lips do respond, not in strange ways, but as I said, they have a mind of their own. But usually when you see a lip, you think, well, this one's not going to do this, or this one's going to do that. Usually it's very hard. If your lip is sloping down dramatically on the side and curled under, it's usually hard to bring it out, but we try. Also, if you have very thin lips and they're almost horizontal, they're harder to bring out. So it does depend on, you know, what the lip looks like, and also on your pain threshold, because obviously, I mean, we do things like put anaesthetic cream on, use the Juvederm Smile with the lidocaine in it. We also get you to do things that don't have a lot of alcohol the night before, don't come at the wrong time of the month, don't come have breakfast. So we try to reduce the pain factor. So there's many factors that, but also sometimes say a patient may have a very pronounced Cupid's bow, and they'll say to me, I don't want my Cupid's bow. Well, that is hard to get rid of in some people. Yeah. So we try our best to get a good result, but sometimes, and if I do predict that it may be difficult, I will tell my patient, I will say, look, we'll try and do it, but I don't know how successful we will be, but would you like to try? Also, another thing that can happen is the lip can look different when your mouth's closed and your mouth's open. So sometimes when you have a very narrow lip and your mouth's closed and we've done a treatment, it may not look that successful, but as soon as you open your mouth and you haven't got it, shut tight, the lip does look a lot better. So I often show my patients now, open your mouth, because most of the time your lip is more relaxed and you are talking, so it does look better. So there's all those things to take in consideration.
What are the main treatments available for lips these days?
Well, there have been over the years many treatments available for lips. You've had the Gore-Tex, things that you've threaded in, Allerderm, all sorts of things. Still, a lot of those treatments have now gone out of fashion. Obviously, still the main treatments are fillers. However, these days you have to be very careful. We, with the British Association of Cosmetic Doctors, tend to just use biodegradable fillers, because anything, there's always this wish to have my lip treatment last longer. Now, good biodegradable fillers now will last about a year. Now, you must be careful if you say, well, we've got sometimes, there's something like 300 fillers on the market. Yeah. And if you hear a comment, well, it's biodegradable, but it will last a bit longer. Now, that means there's something else mixed into it. And in the past, you've had dental cement mixed in, all sorts of things. And this is how you've had all these disasters. And I can't remember the name of the filler, but one's just been taken off the market now. So the safest thing is to have a biodegradable filler. Obviously, you can have lip surgery, but that is also fraught with difficulty. Your mouth changes and you age. There's nothing really at the moment to thread in that's, being that successful. So a biodegradable filler is really the best one to have.
What do you mean by biodegradable?
Well, it's a hyaluronic gel, which appears naturally in your skin and is replicated in the laboratory, and it will disappear totally. So it's got nothing in it, as I said, like silicone, dental cement, this, that, plastic, that stays in there. Because one, if it goes wrong and you get lumps, it's very hard to get rid of. Whereas with, say, hyaluronic gel, you can dissolve it with hyaluronidase. Two, some of these fillers will be all right. Say, you had bioalchemid or different ones. They're all right in the beginning, and then they start developing lumps and hardness, after a period of time. And so the silicone could cause problems 5 years after the injection. So you just never know.
Are there any specific brands or trademarks that people should look out for or ask for when they're having a filler treatment?
Well, I think first of all, you should go to a good doctor, because they are going to use good brands. And you can have the best brand in the world, and if the doctor is not experienced, or the nurse doing your lip filler treatment, you could have a problem with the best brand in the world. So that's the first question. So, and you have various groups such as the British Association of Cosmetic Doctors, you can go on to BAPS, British Association of Plastic Surgeons, various groups like that. You could have a look. Also, when you come for your consultation, if you've got, reasonable questions you can ask. May I see before and after photos? And say, for example, my lip photos are on the Juvederm brochure. So, and ask them about complications. Now, someone who's done a lot of treatments will know all about the complications. So, whereas if, someone's done maybe 50 treatments, although it's not bad, but it's not a whole lot of experience. So I think it's most important to have a chat to the doctor. As with any cosmetic treatment, I always advise my patient, go and see, if you're new to having, say, lip treatments, go and see 2 or 3 people, and you will soon see the difference of one person to another person, and then you'll feel more comfortable. Now, treatments can always go wrong, so if you haven't rushed in and just gone to one place and something does go wrong, you're not going to feel so bad. Otherwise you'll think, well, I've been to 3 doctors, I've made a choice, and okay, this can happen. And things can happen like bruise, swelling, all sorts of things. So then the products, as I said, in general, anything that is biodegradable is going to be preferred because it will disappear. Yeah. Anything that has anything artificial mixed in, I'd be careful. I'm not saying that they all go wrong, but if they do go wrong, it's a lot more difficult to fix.
So other than bruising and swelling, talking about a biodegradable product, other than bruising and swelling, are there any other complications that could happen?
You can get lumps, you can get discoloration, you can get obviously unevenness from the injection, which obviously you can sort out. More serious, or you can get, say for example, cold sores. If you're prone to cold sores, we put all our patients on cold sore medication. If you get a small, which is extremely rare, but if you get a small amount of filler into a blood vessel, you can get necrosis, and you can get an ulcer. You have to be particularly careful up in the frown area here. But there are precautions. Say if you're an experienced practitioner, if you're injecting a lip and there's excessive pain or blanching of the skin, you're going to massage vigorously to try and get that circulation back. But there are things that can go wrong.
How do fillers help lipstick bleed lines? Because surely, it doesn't close the line, does it?
Yes, well you see, if you get them early enough, it will actually lift the line up. So if you have a line like this going down, if it isn't anchored in the tissue below, it'll bring it up. See, because you're putting the filler underneath. Right. If you've left it too long and becomes almost like a scar, then it's very hard.
But there's nothing else other than fillers that you can really put in those lines. Are there any other treatments for lip
Well,
lines?
you can have Fraxel on lip lines. You can have obviously various products. We've now got a new radio frequency treatment called Pelivate that you can have on the lines. So there are other treatments, and often if you've got difficult lip lines, we tend to use 2 or 3 different types of treatments because one just won't do it.
And do you think, the non-invasive treatments like thermage, radio frequencies combined with collagen, with fillers and things, do you think that will replace a lot of the surgical treatments we see today?
Well, I believe plastic surgery has dropped by about 30%, and obviously our non-surgical treatments have gone through the roof. I think the most important thing is to wear sunblock from an early age. And they say that's the best. When they say what's the best skincare cream in the world, it's definitely sunblock. Also to have minor interventions sooner rather than later. If you're starting to get a line, do something about it rather than waiting for it to be so deep where it's hard to do. And also our whole, we tend to try and look after our patient totally. Exercise, nutrition, facial exercises. So if you look after yourself in that way and then have a little bit of radio frequency and a bit of filler, there is less of a need because the advanced technology to have surgery as soon. Having said that, some people will end up having to have surgery, and it's also in your genes. Some people age better than others. But also, now sun damage is a massive ager. So if I get ladies still from, my era that, serious sun damage, drinking, smoking and bad diet, their faces can look, say 15 years older than if they would have looked after themselves. Yeah. So I think that is a big change, the lifestyle change, then having some non-surgical intervention and then take it from there.
Are there any products that are good in preventing lines around the lips?
One of the things we use the Obagi range, which is a medical-only range, and they're so successful with their results that they sell 3 times more than any other medical product in the world. And we use their revolutionary eye cream, the Elastoderm, actually on the lip lines to help those lipstick bleed lines, and we find that that's very helpful.
Fantastic. And can you use that from a young age? Is it preventative?
We'll probably, start at around 30, something like that. You don't need to start at 18. But having said that, that raises a good question in that a lot of my patients say, what age should I start? I say, your age is not the problem, it's where you're at. You could have terrible sun damage at 25 and need quite a lot of treatment. You could be looking fabulous at 38 and hardly need anything. And we do a visual skin analysis here on all our patients, and that actually has a look how your skin and lines are going and sun damage for your age. Then we age you 5 years to show you what could happen without treatments. Then we make you 5 years younger and show you the possible effective treatments.
And hope people don't go screaming out the door.
Exactly.
And lastly, if there was one treatment you think everyone should have, what would it be?
I think everyone should have a visual skin analysis to actually see how much damage you have, and then use a good sunblock, especially not only the face, the neck, the décolletage and the back of the hands, because that is a serious giveaway as you get older. Then of course We've got all the routine Botox, filler, Fraxel, Thermage, but I would say a Visia to get you baseline, and then definitely sunblock and in those delicate areas.
That's lots of good information there. Thank you so much, Rita.
And thank you so much for coming to visit us.